Hello everyone. We are going to do a series on finding and reviewing the scientific literature. The first part is going to be about understanding all those information resources that are available so that we could do a good literature search once we understand them. My name is Vasumati Sri Ganesh. I am from QMed Knowledge Foundation in Mumbai, India, an organization which teaches how to search the literature and how to do referencing. Now, why do we need to search? One, it provides the context and rationale for the study, and two, it demonstrates your familiarity with a body of knowledge. What is the context and rationale? You can see that we've put down here, you need to know what are the important gaps, what people already know, and by understanding all that background, you will know what your investigation will do. Will it contribute something more? Will it improve public health practice overall? So I'd like you to just skim through these points on this slide. What is familiarity with the body of knowledge to do about? When you quote something, you are showing that you have read up a lot, you've not just shooting off something about a topic, you've studied what has been done, what has not yet been done, and why you should choose to do a particular type of study. So with all these reasons, you need to search the literature pretty well. What are the contexts in which you would do a literature search? If you're writing a protocol or a proposal, you need to show your ideas, you need to show the value of your ideas. If you're doing secondary research, a review, a systematic review or meta-analysis, you need to show that you have not left out any important study. And of course, for the introduction and conclusion of any manuscript, you will definitely have to quote where you got certain basic facts from, what others have done. Sometimes in the methods section, you may have to refer to some earlier study which has adopted the same method that you are going to use. So in all these contexts, you're going to be studying the literature and quoting it. After you search, you're going to get a good number of results. So you really have to assess each one to decide which you would analyze if you're doing a secondary research, or from which ones you would take matter to include in your study or quote in your study. So you have to make sure it's a good peer-reviewed article. Has it gone through rigorous editorial? Who has written it? And a whole lot of things like that. So do go through this set of tips by which you assess an article, and then we move on. Finally, the quality of literature review is really not based on how many references and citations you have. It's really important that you show whether that you've understood the issue, picked out the best studies, and finally show a good rationale for your proposed project. In other words, you're showing what has already been done, what is the lacuna or the gap, and why you're doing your study. It is really important that you save all your references because you need to be citing them, and of course some of them you may not use in your current project, but you may want them for the next project. And before you actually search, you've got to understand the type of need that you have, in the sense, if you need something for your background or finally for your discussion, you really need something which is just substantiating what you're writing. And then you need to identify the types of resources that match your needs, and you're going to use the principles of searching when you search. So this talk is going to be based on these 3 points. First point is mapping needs to resources. Our information needs range from simple to complex. So let me give you three pretty obvious examples. We may have a question like, what is bronchiectasis? Why do we need it? We've got to write something basic about it if we are doing a study on bronchiectasis. You might want to know what are the reported adverse effects of inhaled steroids, or you may want to know whether a short course or long course antibiotic therapy is good for community acquired pneumonia in children. Now you can see the first is a simple need, the second is a slightly more complex need, the third is something which is a decision making need. So our needs range from simple to complex. What are the resources that answer these questions? So here is where we are mapping the resources available online or in print to the kinds of needs that we often have. So if we take the first question, which was a simple basic need, the regular simple information resources, whether they are in print or online, are what answer these questions: dictionaries, encyclopedias, textbooks, and so on. The second question is obviously something that emerges out of simple or detailed research. So the most obvious source you go to are journals, but you may also go to primary research which is not yet reported, thesis, conference presentations, and so on. The third, where you need to make a decision, you get evidence from publications called systematic reviews, where the authors have studied all the literature on which of these two therapies work better, and you get an answer whether one is better than the other, or neither is really very crystal clear, or we are still both are equally effective. From systematic reviews, you have what you can use in practice, which are guidelines to treat patients with these kind of conditions, where you're given a step-by-step instruction. If a patient comes to you with community acquired pneumonia and the patient is a child, first you do this, second you do this, third you do this, and all this comes from evidence from systematic reviews or other primary studies. And then you have a set of resources called summaries. These are tools by which you can quickly go over and make sure you've remembered a lot of what you've learned on these topics. Resources like UpToDate, Dynamed, Clinical Key, which has a component, all of them give you summaries on topics. So when you visit a website, check if a website www. whatever there is, if it has type 1 resources or type 2 resources or type 3 or a combination of any two or all three. In this way, you know whether that website can answer your question, and if it is a combination, to which section of the website you go to where you will find your answer. So let's have some examples. This is the website of a textbook, Harrison's Principles, and that's a type 1 resource. So if you need some basic information about a topic, these are the kinds of resources you go to. PubMed is the website of PubMed, where you're going to locate journal articles. Journal articles are type 2 resources. So anything to do with research, there's a great chance you'll find it through this. Cochrane Library has systematic reviews, which are type 3 resources. It has other bibliographical databases of journal articles, which are type 2 resources. So this is a mix of type 2 and type 3. Clinical Key has a mix of all three types: books, drug monographs as type 1, journals as type 2, guidelines and procedure consults as type 3. This is a screenshot of Clinical Key, and you can see books, patient education, drug monographs, these are type 1, journals are type 2, and guidelines and procedures consult are type 3. So just as a recap, when you visit a website, check if it has type 1, 2 or 3 or a combination. Let's move on a little more to the types of databases. We had just mentioned PubMed, but there are other types of databases. So these databases could contain either full journal articles, which could be primary research articles or systematic reviews or a combination, only bibliographical data about articles or about reviews. It could be a database which has data only about trials, trials which have not yet started, in process or just completed. There are several other data types, example data about citations of articles that are published, who else has cited them. So databases are of different types like this. Anytime you're referred to a website, figure out what kind of database it is if it's a website of a database. Let's see some of these. Database of journal articles or reviews. You have journal websites, that is the independent, say CHEST or American Journal of Medicine and so on. You have directories of journals. So DOAJ, Directory of Open Access Journals, is a directory of journals and their articles. The Cochrane database of systematic reviews is a database of systematic reviews. The ACP Journal Club is again a database of specific articles. Bibliographic databases, the national libraries have produced some of these, and PubMed, Medline is produced by the National Library of Medicine on the website of PubMed. You also have Medline through Ovid or many other platforms. This is a database of biomedical literature from biomedical journals. You have private databases owned by publishers, Embase from Elsevier, which is again biomedical, Biosys Previews, which is of life sciences journals. It's literature from life sciences journals. Databases of trials, as I said, trials which have just started, ongoing or just complete. You have the clinicaltrials.gov from the US National Library of Medicine. You have NICE from the UK. You have CTRI, Clinical Trials Registry of India from India. The Indian Council of Medical Research hosts this. The WHO has the International Clinical Trials Registry Protocol. So these are all databases of trials. Still more databases. There's Web of Science, which is a citation indexing of academic papers. If you have a paper, you can check it out on Web of Science to see who else has cited it. Scopus is an abstracting and citation indexing database. Scimago is a database of the citation ranking of journals, which journal has lots more citation than another. There are many more such databases, and we just need to understand each of them if we visit their websites. A word about search engines. Search engines may be generic, like Google, which searches everything on the internet, Google Scholar, which searches all over the internet but only scholarly websites of books, journals and more. Specific is every database like PubMed has a search engine that searches only the contents of that website. It doesn't crawl outside that website. Databases, the same database could be hosted on several different platforms, which means the data in them is the same, but the way you search, the way you get your results, the way you can manipulate your results could be different. You have databases like Medline, which are hosted on several different platforms, that is the www would be different in each case. Each platform provides different features for searching the same database, not just searching, even how you store the output or the results. They give you, some of them give you more options than the others. Medline is hosted by PubMed, which is free, all of us are searching that. It's hosted by Ovid, where it is paid for, has a little more features than is there in PubMed, and several more platforms. Platforms for databases. Let's understand the other side. We just said Medline is hosted on Ovid, but the Ovid platform hosts several databases like Medline, Embase and many others. It also hosts several full-text journals and their databases. So, a summary of this whole tutorial just now. Resources, information resources, we have the basic resources, the research resources or the results or synthesis resources. Databases are structured collections, sometimes available on different platforms. Databases could be full text databases, bibliographic only, databases of trials, databases of citations and other things. Platforms or websites that host information resources could host a mix of databases as well as resources, or could host just one single resource. Search engines could be generic, going out crawling the whole of the web or part of the web. They could be specific to one site, platform or database. So, with that we finish module 1, which was about information resources. I hope you liked this, and we'll move on to module 2.